Hi, everyone. Thanks for joining. I am tremendously sad not to be with you guys in Anguilla. And I hope today will be useful. I'm really thrilled and honored that Chris agreed to come here today. So Dr. Chris Sidford is going to be presenting on some of the considerations you may want to have as the world, frankly, not as your world opens up, because I think it's been open for quite some time, but as you're starting to consider bringing tourists back on the island. Chris has been a long-standing colleague. He's a fantastic resource. He runs a boutique telemedicine business. He serves a lot of high net worth families, both as a doctor and then really provides a lot of helpful advice on a travel basis. So for people who are traveling all over the world, he can help them prepare if there's an emergency. He can help troubleshoot issues if they were to emerge somewhere. So without further ado, he's going to share some slides and some information, and then we're going to open it up for some questions. So thanks again for joining. And Chris.
Good morning, Arden. Good morning, Sydney. It's so nice to be with you, and thanks so much for asking. Like you said, we've been friends for a long time, and I'm honored that you would ask. And hopefully, we can give some information that will be helpful for people who are trying to figure out this very strange year and mixed with, unfortunately, some rather dangerous scenarios. So I'm going to do a little update on COVID. I won't go through the whole background of kind of how we got there, but some of it, it's just to sort of give you an idea of how we make decisions and what might be coming your way and what might affect you. So this is a slide from an office building in Seoul, South Korea. And this is when the illness first started to show up, what people are trying to figure out, is it by touch, is it by breathing, is it by air, and so on. And these are a couple of situations to give you an idea of what's around you and what you're going to try and deal with. And so this is one asymptomatic person, and that's probably the highlight of the talk today, is that how much asymptomatic carriers of COVID can affect other people. So one person in an office building of 170 people, I think 7 or 8 floors, and 91 people in this one person's office got infected. So someone sitting in that one seat in the back there over the course of a week infected 91 people in the rest of the office building. So clearly it's not just contact, but it's aerosolized, it's the air we breathe. And what affects when you get infected has to do with how contagious they are, how close you are, what kind of protections you are, and how long you're with them. And that's kind of the theme for what you're going to try and anticipate if you're going to bring in either family members or clients or customers to your businesses. This is a little more relevant to those of you who are restaurant owners and so on. This is a case from Wuhan, and you can see that there's one person on January 24th. A1 is the person who was, again, asymptomatically infected, and infected half of the people in the room. And it took about, looks like 8 to 9 days for the last person to get symptoms. So that's what makes this so sneaky, is that the person who has it has no idea, and it may take somewhere between 5 to 7 to 14 days for you to either get symptoms or even have the illness and not know it. This is a sad case that's close to us that made the headlines, because we're still struggling, obviously, with a disparity of people's ideas of what's important. Some people think that no masks, no isolation is important, and others are deathly scared and wear masks everywhere and hand washing and so on. And I'm definitely in the camp of wearing a mask, washing your hands, and social distancing. And this is a wedding that occurred in Maine. There were about 60 people in a closed space. Only a few masks were being worn. And the sad part of this is that the 147 people in that little town in northern Maine are now infected, and 3 people have died. And the first person to die, died 2 weeks later, and they never attended the wedding. So one person in the wedding, in the reception, doesn't know they have the symptoms. They get someone else sick in there who doesn't know they have the symptoms. And unfortunately, a spouse of one of the visitors died within 2 weeks. And that kind of highlights how tricky this illness is and how quickly and severe. It can be relatively benign, but it'd be very severe for certain patients. A couple things to keep in mind, because we all have relatives and friends who have this, but the sort of quintessential disease is fever, and then cough and aches and pains is the typical progression. But there are a lot of strange presentations, and I'll go over some of them for kids just to give you an idea of what might be coming your way. If somebody has, that you know, who might be sick or might have been exposed, and they lose their sense of smell or taste, they probably have COVID. Even if the tests are negative, it means COVID is present. And we'll get to the test later, but they're not always reliable. I recently spoke to a good friend of mine who's a physician. She went to the ER, she was short of breath, she had a cough, she couldn't smell. The test was negative, and they said, you do not have it. And quite frankly, the test is negative. It's incorrect. So you have to have a high index of suspicion, meaning if you think you're exposed and you have symptoms that are suggestive, one negative test is not enough to say you don't have it. COVID toes is a weird presentation. I'll show you a picture. It looks like chilblain, or if you've been out in the cold too long, your toes get sort of red and pink. And it's actually a sign of COVID. The good news is it is a sign of COVID, but the good news is that it means that you probably won't have a severe course. So we know it's a sign of the disease, but it means that you probably will not need to go to the hospital or be severely ill. But again, the big message is that somewhere between 3 and 10 or 40% of people who get this never know they have it. And that's what we're struggling with, is that how do you know, how do you stop people from spreading if they don't have it, or they don't care if they have it? This is a picture of the COVID toes. It looks like chilblain or frostbite from hikers. Not terribly severe, but something to keep an eye out for. This is you've probably heard of the multi-system inflammatory, or the illness that affects children. There's some initial thoughts that children do not get that sick, and that's just not that true. They can be relatively benign, but there are some kids who get really sick. This is something similar to what we call Rye syndrome, or we do call Rye syndrome. And I mentioned these symptoms only because now that kids are going back to school, it's the fall, it's cold season. Any of these symptoms here can be a sign of COVID. A fever, strange rash, vomiting and diarrhea is so common, but that can be a sign of COVID. Even bloodshot eyes or being really tired are some of the symptoms that you may come in contact with if you have clients visiting or someone who you think may have the illness. So what do you do about it? How do you prevent it? This is a slide just demonstrating a couple basic things to remember. If you're going to wash your hands 20 seconds, and I will guarantee you most of us do not wash them for true 20 seconds. And they've done a number of studies where they watched emergency room staff, docs and nurses go in and out of patients' rooms where we know we should be more careful, and very few people ever met 20 seconds of washing. So if you want to start with the simple things, wash your hands. You got to take your jewelry off, turn your hands upside down, get your knuckles together, wash them for a good 20 seconds, several times a day, because if you have clients who are visiting from other countries, you have to assume everybody has it. You can't wait for those who you think have it. You have to assume everybody does. One kind of note I saw recently about disinfectants: read the description of what disinfectant you're using, because many of them have a time component. So you can't spray it on and wash it off. Some of them it's up to 4 minutes. I think Clorox is up to 4 minutes. Two things down the bottom, that central hand sanitizer. If you can't wash your hands, a hand sanitizer that's at least 60% alcohol is a good substitute. It's not ideal, but it's decent. But something also kind of interesting is this hand sanitizer, the one that you grab, was actually the most contagious spot in emergency rooms when they cultured it for virus. So if you're going to use them, try and get the ones that are activated by motion and you don't have to put your hands on it. And the other thing is there's an O2 saturation monitor. That's that little black machine. It's actually tiny. It goes on the end of your fingertip. It's a little tiny electronics, only about 15 or 20 bucks. And it can measure how much oxygen is in your blood. And I have one. I've sent them all to my families. They're important because if you get COVID, if you know people have it, it's a nice screening. A lot of people know about the fever idea. You get screened at the airport for a fever. That's not very sensitive. A lot of people will never have symptoms. They're asymptomatic, so the fever won't show up. But if you do get it and you're trying to manage this at home, which most people do, this O2 saturation would be very helpful if you're talking to physicians or your doctor as to when do you need to go to the hospital. So I would suggest you get one of these. You can get them on Amazon, or if you can somehow have someone bring, it's about $20. The saturation should be somewhere around 95 to 99% on room air without oxygen. If you're down below in the 90s or 92%, it means it's time to go be seen in the ER. So if you get it in your community, if you have people who have symptoms, it's a good tool to follow as to when is it time to go be seen in the emergency room. Couple things, masks are an absolute benefit. There was a recent study that just came out and said not only is it a benefit from preventing other people from getting sick, but we now know that if you wear a cloth mask that's about 50% effective in terms of filtering out various particles and so on, if 2 people wear them, then it's about 75% effective. Ideally, what we're looking for is something called an N95 mask. And when you see a number, it says that 95% of certain size particles will not get through that mask. N95s are typically what you want to see in a hospital, or if you have to go to a hospital, and they were not commercially available until just recently. You can now get them online, and I'll show you a couple sites where you can get them. Some things to keep in mind. So the person in the middle has a contractor's mask, the guy with the beard. A beard is a no-no, unfortunately. It means that it opens up the area between your skin and that mask and makes it much less efficient. So I know it's all the rage, but shaving is probably a good idea till this is over. Any comments there, Arden? I see you smiling. You know,
I hate beards in general, so I'm thrilled to hear it.
Yeah, it's just a no-no. And the other one is that contractor's mask, it has a valve right in the front. And it means that when you breathe in, it works perfectly. When you breathe out, there's no filtration at all. So if you're doing construction work in a dusty location, it's perfect. You're not worried about breathing out. But if you're in a situation where you're trying to prevent somebody else from getting sick, those are useless. They will not prevent you from exhaling any of the virus. There was a recent study in the New York Times where they found 2 hairdressers who were positive for COVID. They both wore masks, not N95, but just cloth masks, and all their clients did. They had 130 clients, and nobody contracted COVID. So the masks really do have a benefit. I would highly suggest, I know you don't have cases on the island, but I'd highly suggest you think about, don't think about it, go ahead and get masks. They're very good masks. You can look at the CDC site and it'll list on which masks are useful. And there you can also make your own mask at home. There's some good guidelines on what type of material, a high thread count, a chiffon layer. Those can make them incredibly effective. You do not have to get a medical mask. If you can, and I'll show you the sites, if you can get the N95s or even a KN95, a KN95 means it's a different qualification in terms of the specifics. So it may come from China. It doesn't mean it's a bad mask. It just means it's different. But if you can get those masks, I would say the time I recommend people use them is if you're in an enclosed space and you have to be. If you're in an enclosed space with someone, the first thing is get out of the space. But if, for example, you're flying commercially, if you're going to go to a medical appointment where there may be people in the hospital and you just have to assume that some of them have COVID positive, get an N95, a KN95, and also get eye protection, which we'll mention. So this is what's called a NIOSH mask. It's a 3M N95 mask, but the National Institute of Occupational Safety and Health has verified that it is truly a 95. So that's the verification you want if you're going to buy a mask. And the Clinical Supplies USA is now selling them for, I think it's about $15 each. And if you can get them, this is the only N95 mask I found that's actually comfortable to wear. Most of them are those big cones, they're miserable. So this one folds up and down and you can wear them for quite a while. So I actually did fly about a month and a half ago and found it very comfortable to wear for a prolonged flight. And if you can't get them or you're going to wear them for even longer, this is something called the KN95 and the company's called MyMedic, and they've been selling them for some time. And they have those little packs where you can buy them with gel and with gloves. Honestly, I don't think they're that useful, but the KN95, that is not a NIOSH, just verified, but is still a very good option. And if you can, if I were going to supply, say I was running a restaurant and I wanted to make sure absolutely everybody in the restaurant was safe, this is the kind of mask I'd try and get. Cloth masks, they make some very nice ones now that you can get your company or your restaurant logo put on it, and they can be very effective, particularly if everyone's using them. If you do get masks, if you have the cloth ones, you can wash them in soap and water. The virus is very susceptible to it. But if you get the N95 or the KN95, you can actually recycle those. There's some instructions you can find in the CDC, or you just Google how to recycle my mask. And you can use a rice cooker. You can either do it with dry heat, or moist heat where you put some moisture at the bottom of the cooker and then a towel. And I think it's about 170 degrees for 20 minutes, something like that. But you can recycle those if you're going to wear them every day to work. It's a nice way because obviously they're hard to get and they're expensive. That picture down the bottom, you may hear about infrared wands where you can infrared your phone or your Surface. You know, people have them, they want to infrared their bed or their keys and so on. Yes, infrared does work, and this invention actually, the reason it works is yes, the infrared C works, but they have it coming from every angle, and that's kind of the key. If you're going to have one of those wands, it means you have to have access to every surface, whatever you're trying to clean. So if you're trying to do keys, it's unlikely you're going to get into every little nook and cranny of the keys and so on, or your phone. So it sounds like a good idea, but it doesn't actually work that well. Eye protection is, again, if you're going to be in a prolonged space, like a healthcare setting, a flight, public transportation, I would suggest you put some type of eye protection over it. You may see people in the healthcare setting wearing a mask, as you see with the woman on the right. But the goggles on the left are actually called onion goggles because you can buy them for cutting onions. And I have to raise my hand. I wore these on a flight. They look really goofy, but you know what? They're actually comfortable. They're much more comfortable than the mask, and it was no problem wearing them for a 6-hour flight. So those are, I think they're $6 on Amazon. You can find them. I would actually suggest it, and particularly if you have people at high risk. So if you have someone in your office setting or your hotel setting who's obesity, unfortunately, is a real risk, underlying diseases, cancer, steroids, and so on. If someone like that has to work in your environment, I would say put a mask on and wear these goggles to work. It sounds goofy, but it actually does help. Vaping is a huge risk. It actually is a 5-fold increase. So if you're a smoker, if you use vaping, it unfortunately makes your lungs in a chronic inflammatory state. And as such, it means it's easier for the virus to get settled in your lungs. Social distancing, we've all heard about 6 feet. If you're 6 feet away, it's a good idea, it's safe and so on. That is just a control measure. It is not an absolute prevention. So if you have to go through the grocery store and you can be 6 feet apart and you can wear a mask, that is the best. The really best is to either be 12 feet or 15 away, because a sneeze can actually reach 8 to 10 feet away. And there are a number of people in the early setting of COVID in New York City where one sneeze infected several healthcare workers who didn't have a mask because they didn't know COVID was upon us. But it's a control issue. It doesn't mean you're entirely safe. It's just slowing the spread. So the idea that you can be inside and 6 feet away without a mask is unfortunately not true. You have to have a mask, and the further away and the better ventilation you are, the better. There's a bunch of different tests out there, and we're seeing different information about tests that you can do at home. The standby is something called a PCR test. It's where they shove that thing up your nose. By the way, if they do just in your mouth, the saliva test is just as accurate now, but it takes about 5 to 7 days turnaround. These are about 60% to 70% accurate. It means that if you have the illness, 1 in 3 or 1 in 4 of the people who have the illness, it will not pick up. It will incorrectly tell them they don't have it. And that's an unfortunate takeaway from today's test, is that today's presentation, just getting a test is not an absolute. It requires time, and it requires repeat tests to truly make sure you don't have the illness. The antigen testing means that it's a test that you can start doing. They're starting to do mail kits at home. It's rapid. It's around 15 minutes. There's some exciting news that this may be like a home pregnancy test soon, where you send it and you don't have to mail it back in, and you get quick and accurate results, which is actually one of the keys for us actually tackling this pandemic is getting that kind of testing in the home. But it's not here yet. It is, hope to be that accurate. You can get tested for 15 minutes, but usually you have to mail it in for the antigens. You can get antibody tests. So if you think you were sick, you can actually go to a healthcare facility and you can get a test to see if you've developed antibodies to it. And that's the other big question is if you have antibodies, how long are you protected from getting reinfected? And those antibodies are actually taken from some patients who are sick, and they're used for what's called convalescent plasma. And it's come in the press a lot recently because President Trump recommended that this is a great treatment. It is one of the treatments, and it's possible that it benefits. It's not a panacea. It's not the perfect treatment for everybody. It is just one of the things considered. So a couple other things about the treatment. It's very complicated. There are now antivirals, things that affect or interfere with the viral reproducing in your bloodstream, called remdesivir, that you may hear about. We've also discovered that the people who are really sick have this profound inflammation, so they develop a lot of very small and larger blood clots, and that can be as serious and dangerous as the infection itself. So now patients who are sick enough to be admitted are getting injections of heparin, which slows your blood's ability to clot. So, and the other thing they learned with this is that steroids for the people who are on breathing machines can have a profound impact in terms of mortality. So the mortality in terms of how sick are you and how likely are you to die. When this illness hit New York City so severely, it was around 80% for people who were sick enough to be in an intensive care setting. And by the time the illness made it to, say, New Orleans, it was down to about 50%. So I've learned a lot of things about positioning patients and where they are. And it's turned into a very, an interesting bit of artwork on trying to find a solution. So I don't know enough about the healthcare setting in your island, but I know that even the best stocked places in the world were completely overwhelmed. And the one that comes to mind is there was this decent size, I think 100, 150 bed hospital in Long Island. They had 12 intensive care settings beds. And when this really hit, they had to build 88 additional ones in the parking lot just to try and manage the influx of patients. So it can be incredibly devastating if an entire community starts to get through the community. So something to keep in mind. The vaccines, may have heard of in the press, we're near this phase 3 where the vaccine has demonstrated safety. The good news is that because it's coronavirus, there's a lot of history of testing for coronavirus vaccines and the safety. So we had a platform of information to start building. So they're already to phase 3 where they're large scale testing in humans. So you have to figure out is, one, does it work? Does it demonstrate an antibody? And does that antibody prevent you from getting the illness? And now, unfortunately, the issues we're running into, is it safe for a large population? And we've seen a couple of cases. I think AstraZeneca stopped part of their trial because there was a profound reaction to one of the vaccinations. So it's a hopeful. I can't imagine, like some of the press, is that we're going to have an answer in the next month. I'm hopeful that we'll have something useful by spring. I don't expect anything sooner. So just keep that in mind. The press is, there's a lot of good press, a lot of bad press. So in terms of indoor dining, I'm afraid it doesn't make sense. You cannot control for a number of issues. You need to temperature check people at the door. It's not that useful, but it's a start. Everybody has to wash their hands on a regular basis. You have to disinfect every surface between anytime a client comes in to use anything like silverware or the table. You have to wear a mask. You have to use hand sanitizers. And they mentioned at least 6 feet distance. So New York City has now started to open up indoor restaurants where they're advised to keep at a 25% capacity. It's really hard. And I don't know, the setting that you have. I'm guessing that you maybe have more outdoor options and better ventilation because of the temperature. But indoor is people are going to come in, they're going to take off their masks. And as that starts, some of those people are going to be COVID positive, and you won't know who they are, and it's going to pass through the air in the area, and other people are going to get sick. It's just a nightmare, unfortunately. Even outdoor eating, there are some people that are doing it very well. They have different people clearing the table. They wash their hands in between. Everyone's wearing a mask. It's well ventilated. There's distancing and so on. And they're using plastic silverware so that the person who's clearing it put it right in the trash instead of trying to clean it. There are ways of doing it, but it's really complicated. And I wish you luck, those of you who are trying to do it. I know it's an incredible financial burden for what's going on now, but it is also a double-edged sword. So this is just New York City to give you an idea. And if some of you who are in the industry will watch people who are serving that aren't wearing a mask, or they're not wearing gloves, where they come back, they're incredibly overworked, they're busy, they start clearing the plates of the people who might be contagious, they bring them back inside. If they don't wash their hands thoroughly between coming back out to set each time, then it's just a recipe for spread. One of the things you might want to consider, because COVAC Global is one of the recent companies to come out and say, we will actually evacuate patients who are COVID positive. If COVID starts to get settled on the island, unfortunately, the progression of the illness is of 100 people who get it, about 10 people will require hospitalization, and 1 to 2 people in that 100 will unfortunately die from the illness. So if you're starting to see large rises in the numbers, you're probably 2 or 3 weeks ahead of where you see the real impact in terms of hospitalizations and deaths. And it's a sad number, but it's the reality of how the disease progresses. So this is a company that offers evacuation. If you test positive, they will actually evacuate you even if you don't have any severe symptoms. All the other air evacuation companies will no longer do evacuations, but because COVID is considered a risk to the crew. So if someone gets down there, they have an evacuation policy, they want to go back to the United States, they're getting sick, most air ambulances will not evacuate them back. It's too much risk. But this is a company that you may consider as a part of having people stay in your hotel and so on and say, look, I don't know if you can do the policy, but if you turn positive, we're going to ask you to leave the island because we can't have you overwhelming our healthcare system. And I don't know the accuracy of your healthcare system, but I'm guessing that like most healthcare facilities, if this really starts to spread on the island, it could be overwhelmed quickly. New Zealand is actually a really interesting case study, and it's something I would actually suggest as an island you might want to follow, because they were very aggressive. They said, you know, as soon as this came out, they turned around the cruise ships and said, you can't dock. We know you have cases. We're now trying to figure it out. And they now have a 2-week quarantine, which I know you're considering. But their quarantine is actually, that's a picture of the hotel in the background. Not only is it surrounded by fence, it's surrounded by armed guards. You are a mandatory 2-week quarantine. You get a COVID test, I think day 1 or day 2. And then you get a second COVID test at day 12 or day 13, which is really the only way to ensure someone doesn't have it. You can't do a single test. You can't do a week. The disease can take up to 14 days to present. That's why we came up, why 14 days is the target date. And the other thing that they have that they do really well, which I would highly suggest if you're considering opening, is they have contact tracing. And there's an app, I think I have it. Yeah, so here's one of the apps where when you arrive at the airport, you get a ping that you now have to download this. And this is an anonymous app that will track where you and your phone have been. And it can notify you if someone in that system comes positive. It will know who's been near them and allow healthcare personnel to track who's had the illness and who to recommend now has to quarantine for 14 days. New Zealand has been incredibly aggressive. They have said, you know, they've shut down entire cities for 2 weeks because they were COVID negative. They got 2 or 3 cases, and then they said the entire city is going to shut down, quarantine for 2 weeks. So their aggressive approach, though, is that they have areas in the islands where no one is wearing a mask. There's no interference with business. Schools are going on like nothing's happened because they're incredibly aggressive. And from what my understanding is, you may be in a similar situation where you've handled this incredibly well, but now are taking the steps of saying, are we going to start opening our businesses that are in dire need of clients and so on? And it's going to be a tricky walk, but this is one of the steps that has to be part of it. And the other thing that has to be part of it is that everybody has to be under the same idea of what's important. If there are cases at a certain location, is everybody in the island going to start wearing a mask while they keep this under control? Or are people like we're seeing in the United States going to be offended and consider this somehow personal assault, which I think is nonsense, but that's just my personal opinion. So this is some of the things that have to be part of it. Have to have a means of tracing who's been it and how to quarantine them. And I think I'll stop there because I'll open it to whoever has questions and so on. And I wish you well in terms of, Arden says amazing things about the island. So good luck.
Thank you, Chris, so much. I think that was really helpful. And I even actually wrote some tips in my in my phone to go back and research, particularly on the evacuation side. I want to make sure we have folks kind of can certainly raise their hand. They can chat into the box if they have specific questions. I'll start with some questions, and then if we don't get any, we'll end a little early, but we want to encourage anybody to ask whatever they would like on today's presentation. So I guess one of my questions, Chris, is it feasible that that Anguilla could maintain, this COVID-free environment that they've been able to do as they open the borders to the U.S. if they are going to do the 2-week quarantine? Do you think that's a realistic goal to have?
I think it's realistic if they do the 2 weeks, but the reality is that there's so many sneaky presentations of people who have no illness that I meant to ask, actually, are the airports closed now? I mean, I'm assuming that the airports are open to locals to travel. Is that the case? Or are they literally closed, the airports, for the last 3 or 4 months?
I don't know if anybody wants to kind of bring in on this. My understanding is that it's restricted, the access, because it was previously shut down even for locals who are coming in. You have to get approval is the answer.
Okay, so there are people who are coming in through the airports now. So those same people are just like potential clients. One of the unfortunate discoveries of a number of people who created COVID plans for the universities in the United States is they didn't anticipate that people who knew they were positive would ignore advice, and literally students who would have COVID parties. I don't think that's the case here. So clearly the plan they have now, where I'm assuming if you get approval, you show up on the island, I'm hoping or assuming that they are quarantined for 14 days. They're getting 2 sets of tests. They're tracking. The other thing that I don't know if they're doing is, are they actually randomly testing people on the island now, or are they just waiting for symptoms?
My understanding is it's waiting for symptoms. I don't think there's random testing going, but anyone feel free to chat in if my information is incorrect.
So the challenge, and it may already be on the island. That's the other reality is that if you're not randomly screening some part of the population, you may not know, because it may be a young, healthy patient population where the more severe symptoms don't show up, and people who have a runny nose or a sore throat or a cough may think nothing of it. So I would suggest, as an island, if you would, that they begin random testing. Even some of the universities, they start screening the sewage, because you can test an entire dorm and see if it's positive just in the sewer, and that means somebody in that dorm is positive, and then they screen everybody in the dorm, and they'll screen 10 dorms, they found 1 that's positive, and then they went and screened everybody in the dorm. So I actually wonder if it's already there to some degree, but. So
they did respond in on the chat. There's no random testing. Only people who are coming back to the island are being tested, and that the theory is that the virus went through the island back in January or February. I don't know can that happen where it kind of goes through the island and then
it could. I mean, there are a number of people, I know relatives and a number of people who thought they had it back then and they tested positive. It is possible that it went through the island, and the only thing I'm curious, I don't know the population of the island, but it's hard to imagine it went through the island if there were no deaths. There were no severely ill patients. It's hard to imagine it went through as a minor cold and nobody in that number, but it's possible, and they clearly, if they're doing 14 days, they're screening properly, they're doing 2 sets of tests, they're clearly letting people in under a controlled setting. I mean, I do think that's reasonable. Now, how you do that in terms of the volume you need for a business to survive is the challenge, and how reliable are those people, because you have to be invested in the island's best interest as a tourist. You have to agree that you do not want to bring this illness. Even if you had a negative test 5 days before you left, that negative test is 1 in 4 times inaccurate, and you may be an asymptomatic carrier. So if you do that, people are going to get on the island who have it, if they do the 2 weeks testing and the tracing and quarantine. So could you say, get people to come to stay in a villa for 2 weeks, and then everybody then moves from there to wherever they were going? Is there some sort of public housing, or setting aside a certain hotel where people all go who are within their 2-week quarantine. I think New Zealand even covered the cost of it. Those are possibilities, but the larger volumes to sustain a business make it a real challenge. And it's going to be very difficult to keep it off the island.
Yeah. So the quick summary from the chat is that there were 3 positive cases that were brought in, and they were quarantined. There's a question about one of the deaths and whether it was attributed to COVID or not. Very little antibody testing on the island. There were a few people who went to the hospital in December, but they were told they have pneumonia. So to be honest, it doesn't sound all, and I remember I came back from Anguilla having spent 6 weeks, and I went to Florida. I had the symptoms of COVID. Now I've taken the antibody test and I was negative, but when I went to the urgent care in Florida, the answer I got was, oh, well, it's not COVID because you haven't been to Italy or China. And I remember now I kind of look back and laugh and say, well, that had nothing to do with anything.
Yeah. So, it is likely that those cases were, and every country in the world has made those mistakes. We are among the top in terms of making those mistakes, assuming it wasn't, and people did not know or they weren't informed, and the test can be inaccurate. Like I said, I know physicians who had clear-cut symptoms, tests were negative. They were told by other healthcare providers in the middle of the pandemic, you don't have it. Nonsense. You had it. It just is there. So it's entirely possible it is, and clearly, if there are not an overwhelmed healthcare facility system right now, and they're appropriately screening, that they have reasonable control on the people coming to the island now, absolutely. But they have to then continue the very same plan that they're doing for approved locals. They have to do the same for tourists, and that same time requirement is going to be an issue.
So let me ask you a totally different question.
Sure.
On the dining issue, how much, I'm thinking about the restaurants on the island. You're absolutely right. There are obviously a lot of indoor places, but there are a lot of places that have combined indoor, outdoor, lots of places that are indoor, but open to the air, with.
Right.
So my question is, how much does that make a difference? I know you mentioned some protocols, which I think were really helpful if you were going to do outdoor dining, but, would you be encouraging restaurants to try and take advantage of any ability to increase outdoor dining? Does that really have an impact? Is it better to have people seated near windows? Like, how much of these kinds of changes actually reduce the risk of transmission?
Well, I would remind or encourage people to go to the CDC. They actually have a site for restaurants and how to open and the provisions and so on. I would say I would avoid any indoor dining until absolutely necessary. If it's a survival issue, but it's just asking for a spread. Somebody's going to get by the system. It's happened even under the best system, somehow an asymptomatic. The other issue is COVID can last. We do 14 days, but we know in certain kids, for example, they can be shedding. They've never had symptoms. They can be shedding for 21 to 28 days. So that's the challenge, is this disease is really sneaky. So it's not a reflection on people's ability to screen. It is a really hard disease to contain. So that being said, I would say any place that's well ventilated, and I always go to the outdoors where you can have 6 to 8 feet of clear, any air they're breathing is going away from other people, is the goal. And then the people who are serving them have to be wearing masks as just a basic, and they have to be able to wash their hands and somehow not sterilize, but certainly disinfect the table and uses in between. And I've only been to a few outdoor places in the United States, and some of them are doing it really well, and some of them are not even close. And you watch the people who are working there and how overwhelmed they are and how capable they are. And some people have an entire group that comes in, clears the table, that has nothing to do with serving food or taking care of clients, so you have to be incredibly aggressive and thoughtful about it. And again, if everybody on the island, hopefully, and tourists are buying into the importance of this, it can work very well. But indoor dining, the ventilation is just a huge issue. If everyone's going to take off their mask to eat, then it doesn't matter if it's 6 feet, the air is going to be blowing around the same place. It's going to happen. Okay.
That's helpful. We've got a couple questions here. So
Sure.
It says, Dr. Sidford mentioned obesity as one of the comorbidities that create a higher risk. How risky is asthma, diabetes, high blood pressure, which a lot of our staff suffer from? Their extended families that go home each day suffer from this too. And then also the second part of that question is washing hands versus hand sanitizer in this context. Can sanitizer work as well as hand washing?
Okay, so obesity is probably the #1 risk. A couple other things that they found is air pollution is a risk. So good news for you, northern Italy and New York City, just a slight uptick in the particle count. They know made a dramatic difference in how severe the disease is. But you're quite correct. Other existing asthma is actually not one of the ones on that list. Asthma was originally thought to be a make it sick, make you worse. It does not. Diabetes and high blood pressure are thought to contribute to it, but unfortunately, obesity is the big risk factor. So the person asking this, Peter, it's the perfect question and that's the issue, is what happens when they go home? So you have people are working for a living and they have to go home to this. And so many of the healthcare workers in the early parts of the pandemic stayed in hotels. That is a outrageous step to try and take on, but you really have to consider that. If you are putting people in that setting, that's the one where I would say, if you can find KN95 or N95 masks, I would highly recommend they wear them. I would find them the goggles, because if you can't literally isolate them, then you're right, you have to be worried about them going home. Hand washing, hand sanitizers are good only if you can't wash your hands. Washing your hands is far better. It's without a doubt the best, and the 20 seconds. Liquid soap is better than the foam soap. So the hand sanitizer is not bad, but the washing is by far better.
Okay, another question is, once they open the ports again, should they mandate masks, hand washing, and social distancing again?
Yes.
The answer is yes. Yeah.
Yes, I mean, it just, it clearly has a big impact. And unfortunately, what we found in a number of they just had the big motorcycle rally in, I think, North or South Dakota, and they now have 250,000 cases from that one motorcycle rally, and it's going to cost U.S. healthcare $2 billion because no one was wearing a mask and no one was distancing and no one's washing their hands, in some idea that doesn't impact you. If they open it, then you should consider every person walking on that island and around you to potentially have the illness. So when you go out, wear your N95, your KN95. You can wear a cloth mask. There's nothing wrong with them. They can be very effective. And if everyone's wearing them, they can be amazingly effective. So if they open the ports, you have to protect yourself. The original talk when they had a mask is, oh, you're protecting everybody else. If you get an N95 or a KN95, you are also protecting yourselves.
Face shields versus goggles. Do you have any opinions on efficiency of either option?
So they actually do these crazy studies where they have people cough and do a spectrum analysis of where it goes and so on. The face shields and by the way, if you wear the face shields, it doesn't mean you don't have to wear the mask. You always have to wear the mask. And for my money, the face shield is sort of large and cumbersome. If I were in a setting where the only setting I think that's appropriate is in the healthcare setting, because you're near COVID positive patients that you're trying to prevent. If the goggles, I think, are perfectly reasonable. The mask, I think, is the big deal. But if someone is comfortable wearing a mask, I think the mask is probably slightly better than the goggles.
Do you see a big risk I know this is how most Americans have been eating for the past 6 months, but things like delivery food businesses, so Uber Eats or this is not a common thing on the island, but it's another way as I'm thinking through ways that people could shift their business model if at all possible. Do you see that? Are there risks in that with people dropping food off at a door, ringing a doorbell, all that kind of stuff?
Not really. It's actually a decent solution is to somebody, if there is now a means of a delivery service and there are ways of packing in the food, usually hot food, the workers are usually doing what they normally do. They're washing their hands, but now that whoever's delivering has to wear a mask. There are ways of curbside delivery so you don't go in the restaurant. If it's being picked up at the curb in a car, somebody opens a window, they put it back in. There are easy ways to pay where you don't have to exchange your credit card. Those are all considerations and can be very effective and certainly have helped a number of the local businesses here maintain, maybe not prosper, but maintain some business semblance.
This is an interesting question. What is the best way to educate people on wearing the mask properly?
Boy,
We have this issue here in the U.S. The
I was
amount
going
of
to say, you can't turn to us for that because we are demonstrating stupidity at every corner.
Absolutely,
And
absolutely.
sorry, I mean, it's a challenge. People are getting bad information, and we as a country have not had a uniform, level-headed discussion and presentation. Yeah.
I wonder who's responsible for that.
Yeah, let's pause the recording and then tell the people. So I think it's absolute. I mean, you know, there are different ways of doing it, and literally, there are a number of studies that have shown it's better, but people are under some crazy idea it makes their breathing worse. It does not. It doesn't interfere with your oxygen. It just doesn't, and it's, you know, that's a tough one. There are places like the CDC, the World Health. They have programs that you can use. You can probably download. They probably have demo files and so on, or videos. I can try and see what I can find, but it's a no-brainer. And unfortunately, there are people who are just going to say, no, this is crazy, and this is, you know, I don't even know where to answer some of those people.
But from a common sense standpoint, it's a facial covering, so it needs to cover your nose through your mouth. What I'm always amazed at is you see people with it down here, you see people moving it.
That's useless. The other thing which you have to, the other benefit of masks is it keeps your hands off your face. So when you're out and about, I mean, I literally go through, if I have to go into certain grocery stores where there's a high traffic area and so on, I literally carry a Clorox wipe with me. And I may grab the door handle with it, or I'll wipe my hands as I go through. I'll wipe my hands before I get back in my car. It used to be we were washing everything we bought from stores, and now they really don't think that the stores are the contamination site. But I'll tell you, if there's certain convenience stores where there are a lot of people who are picking stuff up, they're putting it back in, I'm washing that stuff off. I'm washing my hands. It's here, and it's amazingly severe. The other thing I didn't mention about asymptomatic patients is there's this idea that youthful young kids who get this don't get sick. And they now found a number of really high-end athletes at places like LSU and so on. They've done MRIs on their heart. And even though they've never had symptoms, they've had profound changes to their heart that have taken them from being elite athletes to being almost normal athletes. So it really does affect you, even if you never had symptoms, or it has the potential to affect you. So you really have to take it seriously until we have a better answer. And I'm afraid the vaccine, the at-home accurate testing is really going to be the combination for I think the spring, where we hopefully escape the impact of this.
Are there cases of food preparation actually spreading the virus, like somebody who touched the food, then giving it to someone through actual food? Or I didn't think so. But
the only ones I've seen are there's some rather graphic demonstrations of what a buffet does. So that, you know, here's a server, here's a spoon, here's all the people in the room who went through, and in a matter of a minute, they did ultraviolet lighting and tracing, and they found that one spoon contagious, and everybody in the place had in their goggles, their face, I mean, it was everywhere. So those are the ones where I've heard of, and so I haven't heard of any food issues, and I know it was recently suggested it is not the area of concern. The area of concern are the things called super spreaders, where the big events, talking closely, singing is unfortunately a very easy way to spread it from someone who has it. Closed spaces like weddings, church gatherings, and so on are unfortunately where one person who didn't know they had it was particularly contagious and infected a number of people. Those are the events we're trying to prevent.
And those are indoor, outdoor, correct? I mean, those
are almost all indoor.
Yeah, okay.
In fact, I'm not aware of anybody in an outdoor setting, all except for the motorcycle gathering, but those were also bars. And, you know, the other one they traced is a lot of the college students who unfortunately got back to schools, and then the bars, they traced the credit card receipts and said, oh, here are the bars that didn't have distancing and face masks, and here's an outbreak from this bar, including New Orleans. The Mardi Gras was one of the issues.
So now we have, I don't even know if I want to hear the answer to this question because I have a feeling of where it's going to go. But Peter's question is, we're making all kind of plans to reopen. How much worse do you think it will get before it starts to get better?
Well, I mean, it sounds like someone's at least been, the 2-week quarantine, they understand the problem. Whoever is aware of the 2-week idea, and I'm hoping 2 tests. Single test doesn't do it. A second test is better. It's not absolute, but it's better. So if you go to that degree and then you then consider, I mean, honestly, if you're going to open up and everyone's going to wear a mask when they're out in public and everyone's going to wash their hands, then it shouldn't be bad. But if you think how much worse is it going to get, you mean, I'm not sure if they mean for the United States.
Yeah, I'm guessing in the US is where the question is.
Yeah, so we keep having these super spreader events. So all the work we've done for 3 or 4 months is it's almost ruined. There are areas, New York City is down to less than 1%, but I mean, Canada has, I think they had no cases in the last week. I mean, we keep having these islands of independent thinking, I'll put it, that where we then, you know, meat packing and so on, and we're almost back to where we started in some ways, now that we are limiting travel between states. So I'm unfortunate, I think there are going to be, you know, tens of thousands of more lives lost, and literally hundreds of thousands, if not another million or so, people infected with this, because we're just not, we are not close to the vaccine. We have all these variations on what people think is important, and I don't think that's going to work. And the one thing I'll mention is, you may have heard of herd immunity, where people consider that if enough people get sick, the people you will randomly encounter during the day will have already been sick, so you're less likely. That is true at around 60 or 70% of your population infected. New York City, even after the crushing effect they had, I think they're around 5 or 6%. So to get to herd immunity means literally 1 million people or 2 would need to die for the United States to get herd immunity if we stopped masks and so on. So
my worry. No, I actually think, and this, we've done a bunch of webinars on this, as you know, like the anxiety and the restlessness that most Americans feel because we are an instant gratification culture, and this has been totally politicized, is really what our biggest threat is. We're going into the fall, the weather's going to get worse for those of us in the Northeast and other parts of the country, and I think people are going to have a harder time sticking to the things that they know they're supposed to be doing because they're bored, and that's unfortunate, but that's, I think, my biggest concern.
You know, quarantine fatigue, you're
exactly.
And we all are, we're, you know, we're sick of this, but it is funny to see some of the anger at wearing a mask. I mean, that's the anger. I mean, you know, we have generations who went to war or did, I mean, you can't wear a mask. I mean, God, that's what makes you mad.
I'm in Long Island, New York, and we made national news because they had a Chainsmokers concert, like in my town. And I love concerts like anybody, but I'm thinking, like, really, you can't wait another year to see if we can get rid of this virus before we have a big public event with people touching each other.
Right.
So.
I mean, I do think, you know, the island has an interesting opportunity to consider where, you know, what's like New York, even Manhattan, they're trying to think, do we need to have all these streets open? Can we turn them to outdoor dining? Yeah. Can you start feeding people can you put tables down on the beach? I mean, that's the area where I haven't been, but I would guess you have an opportunity without a huge, I don't know the population, but you have beautiful locations. You know, it is an opportunity for some creative responses, and whether it's, you know, somebody's got to walk down the beach to serve your meal, but you're 100 yards from it, you know, or you're 10 feet from everybody else. I do think that you have a unique possibility for doing really different things.
I love it. Well, I don't see any other questions. I want to thank you, Chris. Thank you so much for doing this. We're really appreciative. I know everyone's on the island and we're recording it, so we'll broadcast it on our website for folks who want to watch it again, or if there are folks who missed it. But thank you so much for the time.
My pleasure. So nice to see you all. Good luck, and Arden knows how to get a hold of me with questions, and we'll try and see if I wish you the best of luck. It's we all deserve.
Come visit them. I'd love to see you.
Oh, let me get my bag. I'll be on the way. I have to wait 2 weeks, but we'll all be there. So anyway, very nice to speak to you, and take care. Good luck.
Take care. Bye.